Good evening. This is your Dr. Alvin Cowans, your podiatrist in Georgia. I just wanted to talk to you real quick about hammertoe deformities. You all know about hammertoe deformities is when you have that second or third or fourth digit or fifth digit on your foot that kind of curls like this or so. And this condition is very important to talk about because it affects 20% of the population, according to studies. So when you have this curling of your toe, it's normally divided into two categories. One, either a regular hammer toe. I'm going to get at this model that shows these are the toes, right? When you're looking at the toes, you have right here is a joint. It's called the metatarsal phalangeal joint. This right there is called the proximal interphalangeal joint. And this right here is called the distal interphalangeal joint. And you got three bones of the toe. You got the proximal phalanx right here. And then you got the middle phalanx right there. And then at the very tip right here, you got what we call the distal phalanx or so. And so when you have two times the type of curly toes, you have one, it's called a claw toe, where this is part of where it looks just like, you see what the toe looks just like that, where you have a dorsiflexion of the metatarsal phalangeal joint with the proximal phalanx going upwards and the head of the proximal phalanx sticking up around this area. And a lot of times when you're wearing a shoe or so, that's the area where you get a callus or so from that toe sticking up, is from the pressure of the inside of the shoe rubbing up against the head of the proximal phalanx and that metatarsal and that proximal interphalangeal joint. And so another thing about the claw toe is where this part sticks up, but the rest of the toe, the middle phalanx and the distal phalanx, sticks downwards completely. And you can get another callus or thick tissue on the bottom of the toe due to rubbing of the toe pointing down on the ground. Those ground reactive forces and friction of the bottom of the floor in the shoe causes another callus, causes thick tissue or callus formation on the tip of that toe. When you have that issue, you can have we call painful keratosis or really painful thick callus or so. You can have nail disorder because your nails are pointing down. You can damage your nails and your nail bed. And you sometimes, if you add too much pressure on those calluses and the calluses get thick enough, it can lead to an underlying ulcer. And diabetic patients have to worry about that when they don't have sensation in their toes or so. So that's what we call a claw toe. And then the typical hammer toe, where again, the claw toe is when you have dorsiflexion of the metatarsal phalangeal joint. You have plantar flexion of the proximal interphalangeal joint. And then and you also have plantar flexion of the distal interphalangeal joint. So these two bones are going downwards and this bone is going outwards. That's different from your regular hammer toe where you have dorsiflexion of the metatarsal phalangeal joint. You have plantar flexion of the proximal interphalangeal joint, but at the same time, this distal interphalangeal joint or the distal phalanx tends to stick up still, like this fashion. As you can see, this toe right here, if you can see it, right here, where you have where the distal phalanx is sticking upwards. And that's what we typically call the typical hammer toe or so. And a lot of these conditions, 20% of the population is mostly genetic. Yes, shoe wear can contribute to it. Tight, pointy, high heel shoes, really tight, narrow type shoes can contribute. Biomechanics, or when you're walking, the way your feet hit the ground and you move and propulse off can affect your toe deformity. You have different types of sayings, which you guys don't know, but flexor stabilization, extensor substitution, and flexor substitution. These are different types of gait patterns that can contribute to hammer toe formation of your second, third, and fourth toe. So your gait, the way you walk, can also contribute, but it's mostly caused by genetics. If let's say your grandmother or your mother or on your mom or your father's side has hammer toe, Largely, you inherited it from them. It is a largely genetic type of condition. So, with that being said, first thing you do, if these hammer toes are painful, you want to start off with conservative care. Conservative treatment consists of splints, something to pull the toe down and make it straight, something like a Boudin splint. That's a strap that pulls the toe down but has a padding underneath to pad the toe. You can use like a silicone toe condom that kind of fits the toe and protects it from any friction or shearing force of your shoes or anything that rubs up against your or socks that rub up against the toe curl formation or regular toe curl hammer toe like corn pads or so that kind of protect the area that's rubbing up against the shoe that a corn has formed on the top of the toe. And like I said, corns form from when that proximal phalanx, that bone right here sticks up and rubs up against the shoe. That friction causes that corn formation when you're wearing shoes. So a corn pad will prevent that friction and will prevent that corn formation. So those are very important conservative treatments. If those are not helping, and you're still having a lot of pain in your toe, which a lot of people have, the studies show that majority of those patients that have these issues that need surgery, which is the next step, are most common in middle-aged women, and it's the second toe that normally is the issue. So when your hammer toes become painful, there are a couple surgical options that are done, either arthroplasty, where that bone is sticking up and you take a piece of this top bone out, you straighten the toe, and you will straighten it with like a K-wire or so that can be pulled out of your toe within 4 to 6 weeks. It can be a little uncomfortable sometimes. Not everybody can be uncomfortable with, but it will help to keep the toe straight and reduce that hammer toe contracture. Another one is arthrodesis, where we just fuse these bones together with a hemi implant. They have a neutral implant that's straight to keep the toe straight, and there's one that's about 10 degrees that kind of give you slight curve to the toe, which is a little bit more natural. So the studies show between the neutral and the curved 10% that the neutral straight hammer toe implants work slightly better than the angle 10% angle 10 degree hammer toe implant, but they're still great surgical options. Other things, you can use a silicone clear type of implant or so that can absorb. You can insert. They can act as as you call arthrodesis, a pin to keep it straight. Or if you don't like the idea of implants or a wire in your toe, you can do what we call tendon transfers. The bottom of your toe, we have flexor tendons. We have the flexor digitorum longus tendon and the flexor digitorum brevis tendons. Two type of tendons that get really tight and contract and can cause the toe to be like this. So what you do is you release one of the tendons or so, flexor digitorum longus or brevis, and you transfer the tendon to the top part of the toe, which so whenever you're walking, that tendon fires, it straightens out the toe. So it's just like we call it a tendon transfer. So those are a couple surgical options. I could go in detail about those, but I just want to let you know that there are treatment options for hammer toes. But like I said, not everybody needs surgery for hammer toes. And just because you have a hammer toe doesn't mean that you need surgery. Let pain be your guide, and let it be in your inability to wear proper shoes and inability to walk be your guide of whether you need surgery or not. So, like I said, proper shoes, you want to stay away from the high heel type, pony type shoes, any narrow type shoes or so. You want to not wear an orthotic over top of another insole into your shoe, which will raise your feet and cause friction and cause curling of your toes against the top of the shoe. You want to prevent stuff like that. Some other things you can do. You can help to strengthen the muscles in your toe and the tendons in your toe, so they don't contract as much by, I say, putting a couple marbles on the floor and using your toes to grab those marbles and pull them in, or having a towel laid out and using your toes to grip the towel and to pull the towel up. That will strengthen the muscles and the tendons in your foot, reducing the effect of the hammer toe formations or reducing the formation of the hammer toes. But like I said, it's largely a genetic situation. So the key is if it runs in your family, try to implement these conservative options to prevent the toe from becoming painful if they're going to hammer due to your genetic situation. All right, just wanted to do a quick talk about that. A lot of people have a hammer toe situation, but it's very treatable. Like I said, there's always can be a recurrence with conservative and surgical options, but let you know that there are options and there are things that you can do. All right. If you have any questions, feel free to email me at jeffcfau25@hotmail.com. If you have a little baby, like a 1-year-old, 2-year-old with hammer toe formation, the best thing, instead of going straight to surgery, try these conservative options. You can even massage the muscles in the feet, wider shoes, more supportive shoes, and just wait and see, because the child's too. The child's going to grow, the feet's going to grow, so it may not be a hammer toe formation as the child gets older. So again, if you have any questions, feel free to email me. Thank you for listening, and Happy New Year! Happy New Year to everybody. I hope everybody has a great 2017, and take care of one another. All right. My next talk will be on Facebook Live, so join me there, Alvin Jeffrey Cowans on Facebook. So have a good one.